So, Jeff, thank you so much for meeting me here today. It means so much to the leadership team when a member of the board of directors takes the time to visit our outpatient clinics and see what our patients deal with and what they go through on a daily basis.
I live in this community and know so many of our neighbors struggle economically. I've looked forward to visiting, knowing how important it is to have a new clinic close by. Not to mention, you made a dangerous vacant lot a vibrant part of what I know is a strong community.
Shall we?
I've been waiting an hour. How much longer is this going to take?
I'm sorry, the doctor is running behind, but don't worry. She'll take the same amount of time during your appointment.
I may not be able to wait that long. My babies are at home with the new sitter and she needs to go to class at 1 p.m.
Okay, let me give a knock and I'll check.
This is why it's so nice to have you on rounds, so you can hear firsthand what patients struggle with.
I understand, but the training during our last education session really expanded my knowledge of the many challenges you face managing all that affects health, especially the social determinants of health, things like poverty and violence and addiction that exist in our community. It's reassuring to know leadership here is engaged in strategies to address these long-standing issues, not just trying to fill beds in a hospital.
Why don't we ask this patient and hear firsthand how we're doing? Excuse me, ma'am. I'm the Chief Medical Officer for the ambulatory clinics, and I couldn't help but overhear your concern. Is there something I can do to help?
Yeah, you can. Can you make my doctor see me any faster? Listen, I'm here because I had preeclampsia, and they told me that it was important that I follow up every 4 weeks to make sure that my blood pressures were normal. Now, I can feel my pressures rising right now.
Okay. Why don't we have a seat, and I'll see if I can find out what's going on.
How about I sit with this kind lady while you check it out?
Thanks, Chuck.
What's your name, ma'am?
Cynthia,
Well, I'm Jeff. Nice to meet you.
nice to meet you.
I live in the neighborhood and I just joined the board of our health system here.
Oh, well, maybe you can get them to understand that Black women have an almost 4 times more likely chance of dying after childbirth than white women. I want to see my baby grow up.
I'm so sorry. It sounds like you're on top of your health risks. That's good. And it's also good that you're taking advantage of follow-up care here at the New Women's Clinic. This clinic specializes in the health of women and babies, and I know they have a program in place for new moms with hypertension.
So, I'm so sorry it's taken so long, but we had a patient that needed to be transferred to the emergency room. So, it's not going to be much longer.
Well, I hope they're okay. And I'm sorry, I didn't mean to be short with you. See, I'm a single mom, and even though my job does offer maternity leave benefits, I'm more worried about long-term child care. It's way more expensive with 3 kids. It's just overwhelming at times, and I am just so tired.
You know, have you spoken with your doctor about this? Because we have community relationships that might be able to help you find affordable child care long-term. Maybe ask her for a referral when you go in.
I'll ask her if she can see me before I leave.
Miss Jones, we're ready for you now.
Thank you.
Thank you for sharing your concerns with us. It really helps us design processes and community outreach programs when we know what our moms need.
Well, I appreciate it. Thank you. It was nice to meet you. It was nice to meet you.
I must say, I am impressed with your commitment to providing quality care to our community. I imagine it was challenging and not a popular economic decision. I'm surprised the board supported it.
Well, when we reevaluated our community needs assessment, it opened the board's eyes to a broader notion of healthcare outside the walls of the hospital. It's a strategic investment and one that's core to our mission of delivering better health to the community.
Who oversees the effort to work with our community partners to ensure we're following the health of our patients and coordinating their care?
Oh, we have an incredible VP of Community Development who I'm convinced doesn't sleep. She's constantly meeting with social workers, clergy, police, and EMTs. Plus, she works with our quality analytics person to make sure we're tracking outcomes on a geographic basis and by race and ethnicity, and then to understand any variations.
She sounds like someone I'd like to meet.
I'll connect you. Thank you again for joining me today. Your support at the front lines reinforces that the issues we're working on are important enough for you to come here and learn more firsthand. It gives everyone a sense of pride in their work and energizes all of us to keep tackling these tough problems. Quality is keeping patients well.